Welcome to Straight Talk. I'm Tim Gordon. Today we turn our attention to the homeless crisis in Clark County. In recent years, the county has seen sizable growth, with its population increasing more than 26% since 2010. And while growth can present new opportunities, it can also present new challenges. The most recent point-in-time count shows homelessness in the county spiked 12% between 2024 and 2025. Joining us today to discuss how local leaders are approaching the issue is the Executive Director of Council for the Homeless in Clark County, Cecily Finney-Jones. Finney-Jones was appointed Executive Director of the Council in 2022. Previously, she led a Minnesota-based organization that provides emergency shelter and supportive housing for women and children, among her experience there. Also joining us is Jamie Spinelli, the Homeless Response Manager for the City of Vancouver. Spinelli was appointed to the role in 2021 after working as a case manager at Community Services Northwest. That's an organization that offers support to those experiencing mental health issues, including addiction. Welcome to you both, Cecily and Jamie. Glad to have you here on Straight Talk.
Thank you so much.
Yeah. And we'll get right to the questions. And I want to start by actually giving you both a minute or so to describe your organization, the work you do. And I'm going to start with you, Jamie, in the City of Vancouver.
Sure. So I was hired for the City of Vancouver in this role very specifically to address unsheltered homelessness, which is kind of a role that the city had not previously played in homelessness. So I want to make sure that that's clear right off the gate, because what we do is there's overlap, but it's also a little different.
Mm-hmm. Yeah, for sure. And Cecily, how about you? Council for the Homeless is a great organization.
Yes, it is. Council for the Homeless is designated as the lead agency on the homeless response system in Clark County. So we oversee and implement efforts like coordinated entry system. We oversee the homeless management information system, which is HMIS, where you're getting that data from, so that we're analyzing trends in homelessness, and we're kind of trying to prioritize funding. The funding response, we are the co-applicant for the COC HUD funding that really funds homelessness and housing throughout Clark County, which is really, really needed. We also, lead some collaborative efforts, point-in-time count, Project Homeless Connect, Homeless Persons Memorial Day. So we're seen as a lead agency in Clark County.
With a lot going on. And just
Absolutely.
To put a point on it, your mission statement is really pretty straightforward, isn't it?
Absolutely. Prevent and end homelessness in Clark County, Washington.
There it is.
Yes.
Well, let's talk about the 2025 point-in-time count, because I know it's one indicator, but roughly 12% increase of people experiencing homelessness in 2025 over 2024. Break that down for us. Who are they? And put it in context with, that's a single point in time.
Yeah, that's a single point in time. It's a snapshot. It's done one day in January. We are counting folks that are in shelter and those that are experiencing homelessness on the street, sleeping in their cars. So we have, again, that's a collaborative effort of outreach teams that are going out and making an account. It is a requirement that we have through HUD to do that count every year. And while, yes, we are able to compare year after year, what the trend is, it doesn't give a really good piece of information of what homelessness looks like in Clark County currently.
Right. Well, that's a question I have, and I think it's down the way, but I'm going to jump right to it right now. It's just, what are you seeing then in terms of boots on the ground? You're out there, you're working with people. What is the state of homelessness in Clark County? So
the one report that I really lean into is our systems numbers report, which really gives us an overview of the year of homelessness in Clark County. That's going to tell us, what populations have increased, what has decreased, like maybe families have increased, veterans have decreased. So it gives us a better understanding. And that's the information that we really dig into, analyze, send out to community, out to the state, out to federally, to make sure that we are prioritizing funding for different populations. In the systems numbers report, it looks like 2024 and 2025 is kind of remaining kind of steady. That could look at like a good thing, and it could look like a little bit of calm before a storm. And I know that we are very much looking at how the federal cuts are going to impact our unhoused neighbors, like SNAP benefits and cuts to insurance. How is that going to impact our unhoused neighbors? And cuts to permanent supportive housing.
A lot of challenges.
Absolutely.
In the future, for sure. And Jamie, I want to get your take on this too, because you and your growing team have been busy at the city in the past several years in Vancouver, really developing a homelessness response plan and working it. And let's start with HEART, which is the Homeless Assistance and Resources team. Your boots on the ground there. What are you seeing? And talk about the work of HEART too and what you're doing there.
Sure. So the city's HEART team is a multidisciplinary team. So across some city departments, we've got public works, we have some outreach workers, and we've got a couple police officers that are all kind of designated to that team. Their role, like I said, a little bit different from what Council for the Homeless does, is addressing unsheltered homelessness in Vancouver city limits very specifically. Stephanie is 100% right about the system as a whole and kind of what's happening in homelessness in totality, but unsheltered homelessness is just one piece of homelessness overall.
Absolutely.
And my team, what we do in the homeless response program at the city is addressing very specifically what you see, what most people see: camping outside, solid waste, outreach needs, etc.
Yep, and I've been out reporting and covered the team and the work that they do. What are you seeing now in 2025? Is it changing at all?
Actually, I would say very similarly to what Stephanie said. Over the last couple of years, we've kind of seen a little bit of a plateau-ish. My team, in addition to the point-in-time count, my team does a citywide count in the summer that is similar to what the point-in-time count kind of captures and how it's done, but done a little bit differently. So we do it over like a month-long period because we are really trying to understand what does unsheltered homelessness in Vancouver look like? Who is experiencing it? What are their challenges? How long have they been here? And what are their needs? We saw a 6% decrease in 2025 from 2024, so tiny, but I'm hanging on to it.
Yeah.
So I think similar to the rest of the system, and we still don't have enough resources for all those people who live outside, right? So that's why we do the count and the measuring. What do they need?
Yeah.
And what do we need to be creating real time?
Helps
right?
you know what kind of resources you need, what kind of funding you need to provide those resources, which is obviously a big trick, and that's something we'll be talking more about. But your work, you go out and you work with folks that are camping outside and help them have resources, make sure that what they're doing is safe enough, I guess you could say in a relative term, but but also shut down camps that aren't working.
Sometimes we have to. Just kind of depends on several factors, largely related to health and safety.
Yeah.
But I would also, just because I think it's important, because I come from the outreach world. Outreach is far more than just passing out resources and making referrals.
Sure.
It is like the foundation of outreach work is building relationships with people who are, in many cases, radically disconnected from community. So in order to kind of help them on their journey back into housing, those relationships need to be oftentimes rebuilt, because we're talking about folks who have been let down by systems, right? And so we need to try to kind of rebuild that trust in systems and walk alongside.
That's
Rapport.
starts by knowing people and knowing their names and what they need, for sure.
Yeah.
You know, so many people living outside have individual challenges from mental and physical health issues, substance use disorders. But at the end of the day, it really has to do with shelter first and then housing for people. Affordable housing, is that an accurate statement? Or I see you wince, so I'll start with you, Jamie. What about the affordable housing, the housing aspect of Vancouver and Clark County? I mean, there's new data that shows some parts of Clark County are more expensive housing-wise now than some of the prime spots in Portland these days. So things have really changed in that regard in Clark County.
Sure. We've had an affordability issue for a long time, and I think that's largely due to just housing capacity, right? Certainly that's something that the city has been working on, and maybe I should actually just back up. The city has a housing department, the Economic Prosperity and Housing Department, and most of their work is related to incentivizing and supporting more housing development, because we can build shelters all day, right? And the city has built some additional shelters. We're in the process of building a big one right now. And that is needed for the immediate term, for just health, safety, support of individuals right now who do not have an alternative to living in a tent outside. And those folks need somewhere to exit shelter too. Otherwise, the system is not getting movement. The system that Council for the Homeless supports is not getting movement through it.
Yeah.
So as a city, we are really trying to address it from both angles. What do we need right now for immediate health and safety, and what do we need long term for those outcomes?
Transitioning
Yep.
to housing. Talk about housing in the county from your perspective, Cecily.
Housing is very expensive in Clark County. I think I just read an article not too long ago that said that we're like as expensive as like the top 10% in the United States, which is just mind-boggling. And so people are being priced out of housing. So we really do need to focus on affordable housing. So housing that someone who is on a fixed income can actually pay for month after month, that they're not going to see a huge spike in rent, and be able to do all the things that they need to do for themselves: food, medication, transportation. I mean, especially when how gas prices went up so high in the last few weeks. I mean, we heard a lot of people not being able to take care of themselves.
Yeah.
We want people to be able to pay their rent and take care of themselves and their families.
So important. In the meantime, there is help. There are options for people that you both, your organizations provide to help people get there. Well, we're going to take a quick break now here on Straight Talk, and when we come back, we'll dive into that and how Vancouver's emergency declaration is affecting homeless response in the city. Stay with us. Welcome back. We are discussing homelessness in Vancouver and Clark County today. And Jamie, I'll pick it back up with you. In 2023, Vancouver declared a homelessness state of emergency. Why and how does it affect the work that you do?
So I think for the community, it was important to do the declaration because we heard loud and clear, right? And we saw with our own eyes that there was a crisis on the streets, right? Just the visible homelessness. And I think, so on one hand, the community, everyone needed to see this is a problem that we see and we're taking it very seriously. And then kind of separately but related, there are just a lot of challenges to getting things done quickly in the government. Frustration of mine, certainly, for a long time, even before coming to the city.
Yeah.
And those, kind of the red tape, the barriers, the time limits, et cetera, those occur in many cases for very good reason. You don't want the government to be able to, work super, super fast without a lot of, community input in many cases. But it also prevents being able to respond to an emergency very rapidly. So really it's something we've utilized as a tool in that way to kind of reduce some of those barriers. And what that's helped us with is building some of the shelters. So we got our first safe stays up and running pretty quickly because that occurred during COVID, during an emergency.
Right.
And then that emergency went away and we tried opening a third and that took more than a year. So that helped us with the following 2 shelters and then Bridge Shelter now it's underway.
Yeah, and I'm going to ask you to talk more about those in a minute, but first I'm going to come back to Cecily and talk about the Trump administration changing course really on the federal approach to homelessness. The president's executive order last year basically changing from shelter first to treatment first.
Right.
How does that affect us? Does it get into funding, and how do we deal with it?
I think the biggest issue is housing first is a best practice. It's known to work. And so we're literally removing a best practice to ensure that people have homes. People who work in the homelessness sector know that housing is the answer to homelessness. And so for us to be like dumping that away and removing that from best practices doesn't really make sense for us as an organization. I will say that treatment centers, I haven't heard a lot from treatment centers. How are they going to deal with the amount of people who are coming in, trying to come in the doors because they're trying to get housing? I come from a treatment background. I've had a career in treatment. There's a whole process for people to go into a treatment program. They have to do an assessment. They have to be able to show insurance companies that they need that type of care. And it's like the Trump administration is saying that anyone who's homeless can just walk in the doors of a treatment center, and that's just not correct.
No. And why is housing so important, right? It's about stability.
It's about
getting in
stability.
a place where you can be.
Absolutely. And it works. Even with folks who are, and I know that, lots of people think that mental illness and drug addiction is the reasons why people are on the street. It is not. It is not the only reason. People have their own unique reasons why they became homeless. And it's a lot complicated than just mental health and drug addiction.
Yep.
And so, we need to look at the homelessness sector as very complicated and have all types of ways for people to access, the help that they need. And by saying that housing first doesn't work is just not true.
Yeah. And doesn't your information show that the vast majority of people, the reason they're not housed is because they can't afford it?
They can't afford it. It's too expensive.
Yeah, bottom line.
Absolutely.
Yep. How does the Council for the Homeless in the City of Vancouver, how do you guys work together as part of the kind of community-wide effort? And I'll start with you.
Yeah, so we work really closely together. Not only do we receive some funding from the city, we also are on lots of committees. We oversee and maintain the COC steering committee. Jamie sits on that. We are always collaborating, trying to figure out new and invent kind of creative ways of combating homelessness. So we're really close. And that's what's going to help us solve homelessness, is working collaboratively.
Yep, collaboration. And as you said, Jamie, in some ways you work on the same things, but you also have different roles. Can you describe a little bit more about how you collaborate?
Sure. So one of the reasons that the HEART team, for example, and just this homeless response program was created is because the government just has some unique needs, right? That a nonprofit, any nonprofit, is not capable of kind of accomplishing and should not be tasked with, right? And I come from an outreach background, and I remember back then working with or kind of alongside police officers. We were just often in the same space, right? That's what I mean by that. They had asked me to try to get people to move out of an area for many times, but I have no authority to do that. As an outreach worker, I have
Right.
no authority to do that. But the government sometimes has a need for legitimate reason, for the things that they have to accomplish, and nonprofits do not have that kind of authority, and they should not be tasked with that because we want to preserve the kind of therapeutic relationship that takes place between client and provider. So that, I think, is part of the difference. But we do, because we have the same goal, broad goal of ending homelessness, right, largely, but also just serving each unique individual. There is absolutely a need for us to be able to collaborate and align our efforts where possible, as much as possible, so that we are working towards that same goal.
And the first thing is to get people sheltered. I know there's all kinds of different shelters, emergency shelters, weather-related. But let's talk about the safe stay communities. There are 3 now, is that right?
There's 4.
Yep, 4 now. Very
Yes.
good. And these are the modular, smaller shelter units. We'll show you some video of that. Is that? I guess that's a setup. Maybe that's the one downtown. Kind of a little hard to tell. But in any case, there. Now you can
that's
see
the
it
fourth
going
one.
in. Which one is that?
That's the 4th one. That's Kiggins Village.
Oh, that's the Kiggins Village. Very
Yeah.
good. Talk about them and these and how they're working.
Sure. So prior to our first safe stay opening, our community actually didn't have any shelter where couples without children could shelter together, right? So that was one of the reasons that we went with this particular model. And all of our shelter prior to that was congregate, which is just it's not ideal for anyone, to be fair. But we also are trying to meet, again, some of those unique needs, some of those very specialized needs that some people have. Systems are not designed for vulnerable people with unique needs. Systems are designed for the masses, and a lot of who we serve are people who fall through all of those cracks, right? So we need to be thinking innovatively and creatively to meet those needs. So we have 4 of these sites. They each have 20 units. They can shelter singles or couples without children. We've got a few different nonprofits who are providing services or providing the oversight of those sites. They are a low barrier for entry. Nobody is required to be clean and sober to come in. They're not required to be on medication to come in. They are only required to engage with the service provider that's there, to just move forward, identify their barriers if they have any, and commit to working on those, even if they're small steps. And they're really just intended to be a safe more humane option than living in a
On the
tent.
street.
Yeah.
On the streets.
On the street.
You can't, you mentioned earlier, just like stabilization or stability. You cannot move forward from a lack of stability. Like, I mean,
Yeah.
you have to have some foundation to launch from.
And can I just
Yeah.
add something to that? You know, with the Trump administration and what they're doing as far as Housing First is concerned, removing that, you know, pushing everyone into treatment. What happens after treatment? You know, they still need a home to go into, because if you're pushing them back to the street, more than likely they're just going to relapse
Yeah.
and go back to the same environment they've been using in, the same friends, the same network that they had that that had them using in the first place. So, I mean, we need to look at the picture broadly and not just one little piece of, we want everybody stable before they go into a home. What about let them go into the home, then let's get them stable, and then they will live their lives.
Absolutely, next steps.
Yes.
For sure. Also want to talk about the bridge shelter, which hopefully opening this summer. Is that
Fall.
true? Fall. Okay, we'll
Likely
go with
fall.
Yeah, it's a great spot, just near public transit in the Vancouver Mall, et cetera. Talk about the bridge shelter. It's going up right now.
So that will be a congregate setting, serving adults, couples, and singles. It'll be 2 buildings on site, so a commons building that'll have like commercial kitchen, dining space, et cetera, then more of the dormitory kind of living space building. Do Good Multnomah is going to be providing the services there, just like they do at Kiggins Village. And again, we just need more capacity to get people inside because the streets are terrible to live on. It's raining outside today, right? Just drizzly. Imagine being in that 365.
Absolutely.
I think unique about this space is that we're also working with a behavioral health provider, and they're going to provide on-site medication-assisted treatment or opioid treatment medication every day. So people will have access to, those who need it, will have access to treatment on site. Again, just reducing barriers to what they need to move forward. That's the goal.
Finally, did you want to add
I was
something?
actually going to say something else because it's related to what Cecily was just
Please
saying. Some of a lot of the referrals we get for the safe stays or questions about referring people in are from treatment providers because they are looking for somewhere for someone to go when they've exited treatment. We don't have capacity right now to do that, and so with the bridge shelter, one of my main focuses, in fact, is connecting with all those other systems of care: hospital, jail, treatment, detox, so that people have a direct line from those systems to this space, so that we don't lose them in those cracks.
About a minute and a half left. Funding going forward. You talk about being at a plateau and looking to the future. How is that a dire situation? What do you see in the future?
Funding is always a dire situation.
Yep.
We are anticipating some cuts from the federal government. We want to ensure that we're able to maintain and sustain the programs that we currently have, especially when it comes to permanent supportive housing. Again, we do not have enough affordable housing in our community. And so with looking at these funding cuts, and it's possible that there are going to be large cuts to permanent supportive housing that's going to impact our community hugely, and we are definitely going to see a rise in the number of homeless individuals on the street.
A one-sentence answer. If you could describe for people the thing you want them to understand most about homelessness, what is it?
The one sentence, there are many, are that there are folks who need support services along with that housing in order for the housing to be most effective.
Yep.
And so not focusing on housing does not help the situation. Yep. We need to also focus on the supportive services.
Cecily?
Services and housing is the answer.
There it is.
Yes.
Especially for what people see.
Especially, I'm sorry?
Especially for the homelessness that people are seeing with their eyes.
Absolutely.
Outside, yeah.
Thank you for the work you're doing for the community.
We appreciate you.
Thanks for being here, Jamie
Thanks,
and Cecily. And again, thank you for joining us. A reminder, you can stream Straight Talk on your own schedule. Download the free TV app, KGW Plus. Available right now on Roku, Apple TV, and Fire TV. We'll see you back here next week on Straight Talk.